views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Coming up on this edition of Perspective, studies find that the issue of mental health and wellness is still stigmatized in Black communities as well as people of color. Now, there's so many complexities that actually contribute to this, and whether it be historical, systemical, or any other reason, we're pleased to add our voice to the solution. We'll discuss that and a whole lot more coming up on this edition of Perspectives with yours truly, Darren Hyman.
What's on your mind? Let 'em know. Express what's on your mind. What's on your mind?
Let 'em know. Anything relevant to life, you bring it to the table. Whether you make a move solo or a movement with a stable. No fables, you speak on your decisions. Cause in the long run, it's your voice, your views, your vision. Keeping it real with many messages for you to know. This ain't radio, but DJ runs the show. Entertainment, he rocks it. Politics, he locks it. The host with the most would handle any topic. Don't forget to share your perspective with shines of light. Cause it might make a difference in someone else's life.
And hello, everyone, and welcome to another edition of Perspectives. I am Darren Hyman. Of course, we thank you for joining us as you can every week here on BronxNet's Channel 67. We invite you to stay connected to us on our social media platforms, BronxNet TV. If you're looking to reach me personally, my Facebook page is Darren C. Hyman. And then also on Instagram and Twitter, you can get me there at DCHyme23. There you can get some more information and also find some inspiration as well. We also invite you to stay connected as we continue to elevate the conversation with new discussions and new topics and some very interesting guests. Coming up front and center on the show, we talk about the African American community. Mental health issues are often compounded by the psychological stress of systemic racism. And as a result, African American adults are 20% more likely to report serious psychological distress than white adults. Now, what's more, seeking mental health care is stigmatized within many African American communities, and just 1 in 3 African Americans who struggle with mental health ever receive the appropriate treatment. Now, joining us to share a little bit more, we're pleased to have Dr. Stephen Smith, who's a licensed clinical psychologist. He is the proud graduate of the CUNY Graduate Center's clinical psychology doctoral program that is housed at John Jay College. Much of Dr. Smith's professional mission has actually been focused on addressing the issues of mental health disparities and advancing our knowledge and working with individuals with serious mental health concerns. Dr. Smith's research is actually focused on the role of race in clinical judgments of violence, the impact of socio-political climate and clinical practice, and the use of effective structural competence and humility practices in the treatment of marginalized communities. Dr. Smith currently works as a clinical trainer, and implementation specialist for a first episode of psychosis program at Columbia University. He has a small Brooklyn-based practice that is where he provides psychotherapy, and he deals specifically with men of color. And pleased to have Dr. Stephen Smith with us. And Dr. Smith, thank you for sharing with us.
All right, thank you for having me. Thank you, Darren.
It's an important conversation, and we'll talk a little bit more about the work that you actually do. But let me talk about you for a minute. For you to delve in the field of mental health and wellness is a field that sometimes we don't see a lot of African American practitioners. But for you, you've made it a passion, and also you've made it a practice.
Yeah, I think for me, I was always interested in mental health and behavior. But specifically race and behavior. So I was fortunate enough after, graduating college, I worked for the public defender's office down in Florida, where mental health and race are just kind of these underlying currents that are flowing through the justice system. So I was able to kind of get some firsthand knowledge and then just decided to go to grad school. Where I studied race and behavior a little bit more, but never really dreamed of being kind of someone that provided clinical care. Was really just an interest of mine. And I have to admit, part of why it was because I didn't see myself in that position, right? I didn't see people that looked like me in that position. So it wasn't really on my radar. Fortunate for me, I did have a professor, a black male professor that saw my potential grabbed me up and said, like, you should consider this. And just that alone, that ability to have somebody that looks like you, have somebody that looks like you, I believe in you, really show you the possibilities. That was all it took. And from there, I just kind of went on to study a little bit more, did some more schooling, and just really find my lane, and trying also to pull people up the same way I was pulled up along the way, and just maybe do some good in the world to help people see how systems impact care. So my journey was, I think, a little bit kind of the typical journey of needing to see yourself, and then believe in yourself after. Yeah.
You use the word finding your lane as you were attempting to find your lane through the school of education and really becoming a clinical professional in doing that. Talk to me about what you saw in regards to people of color, African American faces. How many people did you encounter along the journey who were in that same lane, if you will?
Yeah, I mean, not many, right? The number of Black people in doctoral programs is very small. The number of Black people that are focusing on clinical practice is very small. And I'm talking beyond research, like doing actual practice is just far and few between. Conversely, the people you're treating, the people you're focusing on, the people you're researching, a lot of them are people of color, right? So when we're talking about mental health care and those that are in need of attention and services, they look like me. But when we're talking about people that are providing services, they don't look like me. So it was that really was the impetus for me to say, like, wow, I don't want my people, or people that look like me, to be serviced by a system that has traditionally done harm, right? I need to show up. I need to figure out a way to create a lane for myself, um, even if it means I'm one of, a few. Just because I think that it's really important. Just the way that I saw someone that looked like me, I think it's important for the people that we serve to see people that look like them and address the issues that they face.
Where would you describe us on the ladder when we talk about mental health and wellness, particularly when it comes to people of color? We know that growing up, I grew up in that generation of what goes on in the house stays in the house and it gets swept
Right,
under the rug, right? And then
right, right.
all of a sudden, after you sweep it under the rug, you have this huge hump that you now struggle all your life to get over because mental health, therapy, counseling, these weren't things that were often told to us as a community that were profitable to our life. So where are we in the issue of seeing more and more people of color, African Americans, take advantage of therapy and counseling and mental wellness?
Yeah, a great question. I mean, I would, if you would have asked me this about maybe five, not even five, maybe 3 years ago, pre-pandemic, I think I would say we are not doing well, right? In terms of having the same amount of stress, if not more, having the same amount of stress and mental health issues, if not more, but seeking really lower on the ladder in terms of seeking treatment. I think with the pandemic, with the advent of telehealth, with just kind of this immediate blitz of understanding that wellness doesn't necessarily mean you need to sit down in a chair. Um, a lot more people are being available. I mean, there's been a huge push. So I think we are slowly coming up on that ladder and finding that our stuff matters as well, and we could seek treatment. So I think that stigma is still there, but I think the tides are shifting a little bit with the advent of telehealth, with the some media presence, and a lot of just kind of push for, hey, it's okay to have mental health concerns.
Yeah, we hear a lot about barriers, right? That there's some barriers
Hmm.
to, particularly people of color, African Americans, really seeking counseling and finding their footing and their place. We'll use your word, finding, getting in that
Hmm.
lane, right?
Yeah,
What are some of these barriers to us not being in that lane, so to be able to maximize some things that can really benefit us?
yeah. So when I think of barriers, I think of kind of two things, right? I think of like cultural barriers and then like systemic barriers. So cultural barriers usually is what we talk about when we say stigma, right? This idea that culturally, for a lot of Black, brown communities, going to get help is stigmatized, right? We don't have that good relationship with the mental health system, but that's not, like you said, that's not something that we want treatment for. We power through it, we push through it. So that's a very cultural barrier that's still in existence, shifting, but still in existence. I think though there are still current structural barriers that are in play that really impede the ability to get help, right? So it's, for a lot of folks, just access to mental health, right, has been an issue. Telehealth has helped, but in a lot of communities of color, they don't have the same type of access. Insurance issues, right? Thinking about how much, if I do want to seek help, am I limited because of my insurance? A lot of private practitioners aren't accepting, um, company commercial insurance, right? So then people have to consider alternate means, which are usually community services that offer great help, but there's huge care loads, right? So there's these systemic structural barriers that really get in the way of people going beyond the stigma to seek help. And we could talk about a ton of others. There's just not that much public awareness of how someone can benefit from therapy, right? Again, these are all kind of public messaging. Like, that's a very structural issue. Another structural issue is just kind of the mismatch between um, kind of people that look like you, right? People that most therapists are not people of color, right? There's a structural issue there that doesn't allow the field to adjust to reach out to communities of color to find practitioners that look like them. All of these things go beyond the individual and really speak to these larger systemic issues that end up really proving to be barriers and hindrances for people of color seeking therapy.
Yeah. The value, right? I want to talk about value because
Mhm.
I think one of the barriers that we have is, first of all, to cross that hump, to be able to go and do it, to seek a counselor, somebody to talk to, somebody's going to help me make sense and help me through what I'm going through. But then you have this area of cultural competence because as I'm seeking somebody, you testified this just a little while ago, I'm not going to find somebody sometimes that doesn't look like me. And in order to understand me, in order to understand what's going on in my community, in order to understand what's going on in my life, I need somebody that I can relate to. So, how much of a barrier is that when we don't have as many as needed in the area of social work and counseling and therapy that look like us?
Yeah, I mean, it's a huge barrier, right? And cultural competence has been a buzzword in mental health for years, but it doesn't mean that it's actually translated into better care, especially for people of color, right? So you could have therapists that maybe they don't look like their clients, but they have a cultural understanding. And what we realize is that's not enough, right? You have to not just have an understanding of the individual's culture, you must have an appreciation for the structural factors that have been at play, right? So I could understand, for instance, the black experience, right? Like I said, I really focus on working with men of color, right? I could understand how Black men navigate relationships, but if I don't understand how Black people are seen in society, right? And that takes a different level of competence, is to understand like all these external factors that really shape the experience. There's direct experiences with racism, there's vicarious experiences with racism, and then there's these kind of just structural impediments that people of color commonly face. So it's again, it's really incumbent upon the system to say, like, I could understand the individual who's in my office, who's sitting next to me. I can understand the culture, but I also need to understand the structural factors that really guide their narrative, that guide their experiences. And unless we are doing that, I think we're always going to see that just that value that is placed on understanding someone and what they look like is not enough. It's not enough, and people are going to be deterred. Young people of color are going to be deterred from coming and sitting with you. It's not enough to say like, "Oh, I understand Black people."
All right. Take a quick break. I want to come back and talk more with Dr. Smith, talking about the issue of mental health, wellness, counselors. We got a lot more to discuss, so stay with us right here on Perspectives. We'll be right back. And welcome back to Perspectives. Darren Jaime here with you. We are continuing our conversation with Dr. Stephen Smith as we're having the conversation about mental health, wellness, when it comes to the African American community and people of color. Dr. Smith is one literally with boots on the ground and feet at the desk of those in serving and helping, and really has a great clientele. I want to talk to you, Dr. Smith, a little bit about the work that you're doing right now, and give us some insight into how things are going for you in terms of the work that you're doing in this particular field.
Yes, a lot of I've kind of I try to address this work on two different fronts, right? So one of it is like, how do I help the system, right? And so a lot of my work is training clinicians on just understanding culturally the people that they serve, but also understanding structurally the things that they need to pay attention to. And so, I work for an agency that is hugely focused on helping clinicians really tap into, like, what do you bring to the table? How do you show up? What are the different things, your different intersectionalities, privileges, powers that really guide the way you see other people? And then how does that translate into the work that you do and the care that you provide for the participants and the clients in your practice or in your programs, right? So we're really working a lot with clinicians to really first work on themselves, to then work on understanding the individual and the kind of the systems that surround the individual. And when you do that, it really opens a space that's different than kind of traditional practices, right? Traditional practices focus on the individual being the problem, the focus on changing the individual, but it doesn't really address external factors. And I think, for me, that's one kind of way to attack the issue, is to help people see that there's a whole picture there. And then the kind of second is, I love working with people of color, particularly men of color. And we work through a lot of the challenges, both big and small, in my practice, to help them get their footing and have some compassion for themselves. Yeah.
And when we talk about people of color, we know that we talked about the stigmatism, we talked about the marginalization when it comes to finding people who actually, can identify with what's going on. But I think when we look at what we're coming out of and still navigating the COVID pandemic, it heightened a lot about the need for having a safe place and a safe space for so many people who felt isolated, so many people who felt trapped. People lost their jobs, food insecurity, lost loved ones. For yourself, did you find that during this pandemic that your work is heightened?
Oh, absolutely. I mean, the surge that happened with the pandemic, you're talking higher rates of anxiety, higher rates of depression, isolation, unfortunately, among youth, higher rates of suicide, all kind of stemming from these last 2 years. And fortunate enough, there's also been just a surge in people seeking help. And also fortunate that there's been kind of increased access to health with telehealth. Um, the one thing that I think people have to keep in mind is there is anxiety, general anxiety, that comes from the pandemic. But a lot of what the pandemic did was unearth existing things that people were struggling with, right? Existing vulnerabilities that people are struggling with. So, it's really speaks to this idea that as a society, we're just kind of, pushing through with a lot of different stress. And for people of color, that stress has been just slowly bubbling up to the surface, and that's why they're coming out in droves saying, like, I can't do this anymore. I need either a mental health break, I need treatment, I need to step away from my job, I can't do this anymore. And it's because this pandemic really shed light on all the ways that we haven't treated ourselves, and the system hasn't treated ourselves as being valuable. So it's been a huge surge in
Well, what
people.
do you see right now that we can be doing in order to make this better, particularly when we look at criminal justice, right? There's some need to really talk about mental health with regards to criminal justice. In the social setting, mental health is still not where it needs to be in terms of being addressed seriously. But from your perspective, what do you see needs to be done?
I mean, I think big, what I notice is a big messaging issue, right? So we could say there's not enough, you know, access, we need more funding, but there's a huge messaging issue that places mental health as problem focused, right? So when I have a crisis, then mental health comes into the picture. When I have a breakdown, then mental health comes in the picture. But mental health is happening every day, everywhere, even if you're doing well, right? So if anything, I think we need to figure out a way to reposition mental health as similar to your daily health, right? These are things that you need to tend to on a day-to-day basis. Yes, some days is going to be more salient, some days are going to be more problematic, but just seeing it as an outcome of problems or crises really treats mental health as this thing that I can get to whenever I have a crisis, when it's actually something we need to work on every day. And I think that the way of seeing mental health is I wake up and my mental health is activated, my mental health is playing a role. I think we could start to do different things, um, on an individual, on a societal level, to help people address what's going on for them. So that to me has always been something that
Yeah,
just kind of yeah.
I kind of fall along the same lines because I think many times we have these conversations, we're having them from a reactive place, a
Yeah.
reactive posture after something has happened.
Hmm.
But to really address the issue proactively, sometimes if we're proactive, we won't have to necessarily be reactive.
Reactive, right? Exactly. And mental health is you're a living being. You're having thoughts, you're having feelings, you're having reactions to everything, every second of your life.
And I think
Why not?
but share with me a little bit because I think that's part of that stigma too, right? Because if my knee hurts, my foot hurts, I'm going to podiatrist. If my
Hmm.
you know if my teeth hurt, I'm going to the doctor. If my eyes, I'm going to the optometrist. And somewhere along the line, we've got this notion in our head that if I'm just trying to work through some things or I got a headache based on the issues of life
Yeah.
that I can't go see somebody because that's gonna portray me as looking crazy. But
Right.
we know that there are a lot of workplaces that actually support having their employees get counseling. There are a lot of, and there's still a fight in the insurance industry, but
Hmm.
a lot of insurances are now becoming more and more adaptive to allowing people to get the help that's needed.
Yeah, absolutely. I mean, I think the idea of mental health being similar to mental health is part because of the mental health system's messaging, right? It's we didn't do a good job to convey this idea that, hey, we might not have the answers, but there's a process of working on issues that can be really beneficial to folks, right? I think we often get kind of grouped into this idea that, well, if I just take a pill, it will go away. It's not that simple, right? And mental health is not like diabetes, or it's something that you're constantly working at. It's something that creeps in ways that you might not be aware of. It's something that speaks to things that you are uncomfortable about. So if we can help people see that, there's ways to understand self, there's ways to have compassion for self. There's ways that we could, small ways that we could help you move forward when you feel stuck. I mean, I think that's huge. It shouldn't be this idea of fixing. It shouldn't be this idea of, here's this one place in your life you need to work on. You need to take a pill for it. No, mental health is everything, all encompassing.
Yeah.
So again, it goes back to that messaging. I think that's really important.
Are you noticing where you're working any common threads among the things that people are really wrestling with and dealing with amongst your clients?
Yeah, I mean, I think there are a few different threads. Relationships come up a lot, right? That usually is what's bringing people. Relationships, stress, anxiety, depression, like those things come up, and they're often intertwined. And we get a lot of anger, right? It's kind of deep seated anger. Um, Relationships come up because people are at a place in life where their relationships are in turmoil, or they're turning a corner, and there's stuff that we haven't dealt with that are just kind of like uncontrollably coming to the surface. Anxiety comes up because we're all trying to like keep a lid on things.
Mm,
We're all trying to just power through. Depression comes up because we feel we have no control, so we end up turning it on ourselves. Those things uh, come up, yes, related to the pandemic, but more so because we just haven't tended to ourselves in ways that we should. And I think hopefully those themes will start to erode as people have develop a different relationship with their wellness and interest in their mental health.
Dr. Stephen Smith, I gotta leave it there, but I want to thank you so much. I think it's a very critical conversation for us to be having, particularly in a time like this. You know, there's so many people who are dealing with anxiety, depression. You watch the TV, you see what's going on. You know, you got America Now talking about Will Smith and Chris Rock, and the issue of mental health and wellness will come up again. You're going to see things continue to play out, but I'm grateful that we have you here to be able to share with us a little bit about that area as well. And so we're going to bring Dr. Smith back. Want you to know to have a deeper conversation about some issues. You know, how do you seek help? How do you know when it's time to get help? Right. So we want to bring him back as a voice that we could be able to lean into and be able to get some clearer understanding and possibly help some families who really need a deeper dive in the issue of mental health and wellness. So, Dr. Smith, thank you so much for being with us here on Perspectives.
Thank you for having me.
All righty. Well, let our viewers know this about wraps it up for this edition of Perspectives. I will leave you with this perspective that we talked about in the show. A lot of times people think when it comes to mental health and mental illness, that there's that stigma. It's a bad thing. But the reality is all of us deal with it, right? We deal with anxiety, we deal with stress, we deal with, trying to make it over. And there's no harm in having someone to talk to. There's no harm in talking it through with somebody. I think the harm is in isolation. And so finding a safe place to be able to talk to someone, finding a safe person that you can be able to really mesh some things out with on a professional level. It's nice to have your boys. It's nice to have your girls. But I declare it's a good thing to have some professional help, and particularly somebody that looks like you and sounds like you and understands the culture. So don't shun away. Just try it out. It just might make a difference in your life. I'm Darren Hyvey saying take care. God bless. And thank you for watching this edition of Perspectives. We'll catch you next week.
Make a difference in someone's life. Express what's in your heart and your mind. Share your perspective.